You are listening to Seniors Junction podcast. Your hosts today, Dr. Namrata Bagaria and myself, Dr. Paul Merkley, co-founders of Seniors Junction, and our special guest is psychiatrist and emeritus professor from Duke University, Dr. Dan Blazer. Welcome.
Good to be here.
Thank you. So tell us, if you would, a little bit about yourself and what you do.
Okay, I'm Dan Blazer. I am an emeritus professor from the Department of Psychiatry at Duke, just as of July 1st. So I'm a recently minted emeritus professor. I was on the faculty for 45 years. I've had an interest in social isolation for going actually beyond that. In the early 1970s, I was a medical missionary in Africa. And during that time, I got very interested in older persons who kind of paradoxically seemed to be healthier. They seemed to be not only respected, but well connected into their communities. And they basically, I was interested in mental health issues, and they seemed to be, compared to most of the population, relatively free of the types of problems we might expect. Of course, there was some dementia and some other problems, but they seemed to be doing quite well. And that led me down a path to try to explore social isolation, loneliness, social connectedness in various ways, and ultimately looking at social integration as means by which older persons might do better in communities compared to what we often would see in North America. So that third world experience was a very important experience to me, given that. I returned to, at that point, I had not been trained in psychiatry. So I returned to Duke, began my residency, finished the residency, and then was fortunate enough to receive a grant so that I could go back to school and receive my Master's of Public Health and PhD in epidemiology at the University of North Carolina. And so the goal of that was to launch some epidemiologic studies related to older persons in general, but also focusing on social issues that were related to these elderly individuals. And we had three programs that I was the PI on. One was the epidemiologic catchment area studies. The second was the established populations for epidemiologic studies of the elderly out of the National Institute of Aging. And the third was the MacArthur Research Network on Successful Aging. I've sort of come full cycle on that as I was nearing the end of my active career, chairing the committee for the National Academy of Medicine, which actually produced a report on social isolation and loneliness. This was supported by the American Association of Retired Persons, I guess ARP is what it's called now, foundation. So I've had a lifelong interest in social isolation and loneliness, and much of my research has been focused on that, though obviously it's branched out into many other areas as well.
Thank you.
Thank you. And honestly, it's such an honor to meet you, because I did read the report that you're mentioning, and that's how I found out about you, because I started reading it because Paul and I were doing some research, and we were like, okay, we know there is senior isolation. We know from interviewing different physicians, there is physical and social isolation. And we were sort of positioning ourselves as social connectedness, because that's what our market research is showing. We want to use positive words, but also actually mean it. And so we were like sort of struggling to find a relevant clinical model, medical model to get a better understanding, and then to sort of draw the line what we don't do and what we do, because we are a preventive wellness organization, right? But at the same time, if you want to do customer end-to-end service tie-ups, we could look at whom else should we go to and sort of map out that kind of care ecosystem. And so for me, that in this extensive career, and now that you've also been through a pandemic, where social isolation is now not just an older adult population thing, it's visibly everywhere. So what do you, according to you, what are the pain points in social isolation and especially in senior isolation now?
Well, I think that what we found during the pandemic, and unfortunately, I think it's going to continue for a while and maybe even accelerate, we found that older persons were probably not only more isolated in general, especially in first world countries, than other segments of the population. When, for example, often the best and perhaps only confidant that an older person might have would have been a spouse. And then if that spouse dies, then that older person may be especially at risk for being isolated. Their family may care a lot about them in those circumstances, but the family may be scattered in many different places and not available, or the family may have multiple demands upon it, such as having to raise children themselves. And for especially older persons, there would be grandchildren that the children will be managing. And so what we have are individuals who might, in theory, be able to provide care and concern for older individuals, not as available as perhaps they may have been 50 or 75 years ago. Geographic isolation certainly is an issue. We found older persons in rural areas being a greater risk for being isolated. We're so much connected by and Bagaria, Dr. Bagaria, this is something that you would know a lot about. People across the life cycle are becoming increasingly facile in using social media to make contact with individuals. Unfortunately, many older persons, that's just not something that they have learned so far. I think the next generation up of older persons, maybe 20 or 30 years from now, we'll see that change fairly dramatically. But it's not true now. And there are many groups that are trying to make these types of technologies available to the elderly. But I think helping older persons to learn to use them, and then dealing also with issues such as disabilities that older persons have, which may in turn prevent them from using them. Cognitive impairment, visual problems, these types of things may limit their ability to use social media. And therefore, we're increasingly becoming a society where social media becomes one of the main, if not the main way in which we keep contact with people, and older persons are cut out from that. So I think that's, to me, one of the key things to recognize. I think that it would be interesting. I'm just not an expert in this, but I think it would be interesting to really see what's happening in less developed countries where families tend to be more congregated together and where there's a very clear role for older persons. Grandmothers and grandfathers, for example, I think play especially important roles in caretaking and other roles in families. And therefore, I think that would be an interesting area to explore. Grandparents often are at some great distance from their children and their grandchildren. And therefore, other than maybe an occasional Zoom call or something like that, there's not as much contact as we might see. So I think those are some of the things that we thought about it. And I think the other thing I would emphasize at this point is that this is not true of all older persons. It is not true of many who may be well embedded in communities. They do not say that they're lonely. In fact, they may appreciate not having as much contact with people as they sometimes find themselves having contact with them. But there certainly is a group of individuals out there who are isolated and who feel very lonely. Final thing I'll say at this point is that though they're clearly correlated, loneliness and social isolation are not the same. You can be lonely in a crowd. David Reisman found this out, 70 years ago, and his colleagues. You can have people all around you, and yet you feel lonely because you just don't feel like you're connecting with those individuals. In addition, you can be socially isolated and not feel lonely. You might be quite content to be relatively on your own, doing your own thing, etc. So, and there's certain, and I, of course, have been very interested in health outcomes, given the fact that I'm a physician, and that's been the primary focus that I've had, health and mental health outcomes. Given those health and mental health outcomes, I think it's important to recognize that social isolation is probably more important in terms of adverse health outcomes than loneliness. Though we don't have the evidence completely, I think that's an important factor to keep in mind. We know a lot more about social isolation than we do about loneliness, though the literature on loneliness is increasing pretty dramatically.
Mm-hmm. Mm-hmm. This is very profound. I mean, there's so many points I would like to reply to. And Paul, I'm going to just take some time and then we can go to the next question after that. But I would like to reply to some points which I think have counter discussion. I think there are 2-3 things you mentioned. Developing countries, like I'm originally from India. And if you see the way India is now, in the 80s, when we were growing up, that was a trend for nuclear families. So we did visit our grandparents, but we didn't live with our grandparents. And then there was a trend in the 90s and the early 2000s for most of us to study outside India, like in any country like US, UK, Australia, wherever. And now most of us live outside. So within a generation, you see India, which was typically a place where you would have multi-generational families. There is no script of what should older adults do, what is their purpose, so-called, after the kids after they're empty nesters. So that's something I completely understand. Then the counterpoint for the role is, I was looking up some research for a paper which I was writing, and Okinawa in Japan, which you know is a blue zone, they have the concept of moai, which is lifelong friendships. And these are your families outside your family, 5 friends you commit to. And Paul and I have been discussing, what about people like us who travel, live everywhere, and we really can't have a moai. I mean, I do meet my friends in India when I come back, and especially in the pandemic when there's a window to meet, like you only can meet so many people, right?
Yes.
So the concept of a digital moai is one thing that we've been talking about. And parallel to that, the role, like you said, there's enough research to show people in Sardinia, in Greece, or older adults who crossed 100, they were near the farm, they were working with the livestock, they have a clear role in the rural life. And even they've seen the effects of urbanization in Japan when the children of the people who are from rural Japan go to urban, let's say Tokyo, and they have roles there, and they were interviewed, would you come back? And they're like, only if emergency, only for estate management, maybe once the kids grow up. So even in Japan, there is a whole research going on about the role, and the older adults who have the village roles, like the roles of a community leader or managing a temple or a Buddhist temples, they have far better health outcomes than the ones who don't. Yes. And then something that Paul and I have been discussing is the modern version of it. Let's say, you have social clubs like Probus and Rotary and Lions and so many other informal walking groups and support groups. And we've observed, and personally too, that people, we also do better when we have a bunch of people where you commit to when you do certain activities, especially in the pandemic. I have done so much online. This podcast was one of the things of creating our online community of people interested in the same topic like us. So I think a lot of what you say is yes. And what worries me is the next generation, let's say the millennial, Gen Z, Gen Alpha, they by default are not connected. They're disconnected since they're young, because we see it with our younger colleagues, our interns, the way they interact. And we wonder how that aging would look like, because even the concept of relatedness or connectedness doesn't exist strongly. It's a lot of autonomy, a lot of loneliness. And what we've understood is connected autonomy is what you need really to age well, age healthy, and have really like less inflammatory responses. So what is your opinion on this whole demographic shift that we see in aging?
Well, I think first off, I think there's increasing evidence suggesting that if you just ask who are the most lonely individuals in a society, it's the younger adults and teenagers. They're the ones who report this more than older. And I think you've pointed out what I would see to be one of the prime reasons is that they're not connected. Older adults, even if they are maybe isolated geographically, have maintained connections. I mean, I'm 77, and we just made a trip. We've got a number of friends in Tennessee and in, well, specifically Tennessee, in Nashville and Memphis. So we just took 9 days out, traveled to Nashville and to Memphis, and we spent a day with each of 9 couples that we had known over the years. And those relationships have remained strong. We don't see them that often, but it would seem like when we get together, nothing has really changed. I don't think that's going to be true from our children and our grandchildren. I think it's going to be different. And that gets to what I think is going to be a major problem. People are just don't form those strong connections like I think my generation did, and certainly generations before me did it even more. So I think those are areas that society really needs to look at. Again, being a healthcare professional, that's a major concern. There are a number of healthcare systems that are recognizing that loneliness and social isolation are significant risk factors for adverse health outcomes. It's not just because there's nobody there to kind of help them get to the doctor or take the right medications, et cetera. There's something going on beyond that. And so they're beginning to consider implementing programs within the system. In other words, if you belong to, for example, United Healthcare, that's where you have your insurance, you're going to be asked and given the opportunity to participate in or programs that engage you with other individuals to try to overcome this problem of isolation.
Mm-hmm. Mm-hmm. Paul?
It's fascinating. So you've articulated your vision, a fair bit of it. I'm wondering if you have any thoughts about constructing something analogous to the ecosystem you've discussed in developing countries, or what you think we could do.
Well, I'm going to go back to our president, George H.W. Bush, who probably didn't follow up on this as much as he would have liked. But remember, in his one of his addresses, he talked about 1,000 points of light. And so I guess what I would emphasize is that I don't think there's one solution. I think people are quite varied. And so I would look at a number of different entry points where we might try to overcome this. I just was talking to a colleague yesterday. It's kind of interesting. This has been timed as well as it has, who I'd not actually had contact with in probably 15 years, but he was a good friend. He was on the faculty at Duke for a while, and we became very good friends then. And then we just kind of lost contact. So we decided we would Zoom and get back together. He has formed an organization and has been working on this about 10 years now, where they are getting individuals who are not healthcare professionals, not necessarily well educated, but giving them some brief training, but then working with local healthcare facilities, insurance companies primarily, to try to decrease the level of re-entry to hospitalizations once individuals are discharged. His particular area is cardiology, but he wants to spread this to many different ones. And so his plan is to actually have someone offered to have someone go into the home of a person who's just recently been discharged from the hospital, visit them like 3 times the first week after they leave the hospital a couple of times the second week after they leave the hospital, and then one time a week on the third, fourth, and fifth time. The goal here is specifically to be sure that they understand their medications, that they're settling in, that they're not symptoms that are cropping up, et cetera. But it's a broader goal. It really is a goal of really attaching individuals with other individuals for a period of time, a very critical period of time, once individuals leave the hospital. And this has proved amazingly successful in keeping people out of the hospital, which is a huge expense, obviously, on our healthcare system. So that's that type of thing. Now, that's one isolated example, but I actually give it because it is an isolated example of one point that you could focus on to get into surgery. There are other things that could be done. I think that programs where communities just make available and try to identify individuals who are isolated, and then through phone calls or in-person visits, and if the older person doesn't feel like having someone in their house, they can do it through the screen door. I think developing multiple programs. I think religious organizations can be very active in this. I think there are senior centers and community centers that can be very active in this. As I said, I think the healthcare system can be very active in this. I really think that it's going to take multiple efforts. And the big mistake for me would be to think that one model is going to fit all.
Mm-hmm. Is it a bit of a gap that we have vis-a-vis some of these other countries, in that we have a much more secular society, and has the diminished role of religion made a bit of a gap here too?
Oh, I think definitely, yes. There are, if you look at religion, again, especially I think in the United States, if you look at religion, what you find are sort of broadly kind of two different types of groups. This is kind of making an artificial division, but I think it's a division that's worth taking a look at. One is you have the older congregations, usually a little smaller, maybe 200, 300 people, that would be it. There are individuals who have attended those congregations or religious organizations for decades. They all know one another. There's kind of a natural support system built in. If someone is sick, everybody knows about it within a week, and they're on top of it. If somebody needs a ride to the hospital, there's someone who is there to provide it. Or if someone is just lonely or gone through a loss, there'll be someone who can provide that because they've been friends for all that time. So that's one kind of prototype of a group. I think the other that we see are these, what we call mega congregations, very, very large religious organizations where you almost go, and I don't want to be prejudicial here, but you almost go just to be entertained. And you go on a Sunday morning, or you may go to something on Saturday or whatever. You would go to those religious groups and you sit and you hear, really interesting music, not necessarily the music I would want to listen to, but music nevertheless that might be interesting to that generation. And maybe hear a sort of a good pep talk, and then you leave and virtually nobody knows you. And so trying to think about that organization, even though it kind of feels good for an hour or two a week, there are no connections, or there are very few connections. And therefore, calling on those individuals within that group, I think, that's part, I think, of the secularization trend. And as you probably are well know, the number of people who now affiliate with some religious group has declined in the United States below 50%. And so I think that is going to be, I think we're going to see that more. I think of one of the books that I really enjoyed reading a few years ago was by one of your fellow Canadians. That's Charles Taylor's book on a secular age. And I think that is really an important issue for us to track, because I think secularization is going to be associated with increased loneliness and isolation.
Thank you.
And thank you for validating our assumptions, because we've started, like Paul and I started this as friends socially. This started around Christmas. 12 Days of Christmas was the first event we did, because we know that holidays and times are trigger times for, even if someone who's in general connected, but because your senior centers are shut, like it's the peak time where it should be open, but they are shut in those times. Versus, like, I come from India, where during festivals all shops are open because you're going to do more business. It's a reverse mindset. You know, so it's kind of, for me, because and I've lived in the US too, right, for my studies. So when I see the different norms, it sort of makes you realize, why are people so lonely? Because in our time, even if our neighbors, we go and say hello or something. I mean, it's lesser and lesser in the cities. I mean, I wouldn't say that we are super connected, but way more connected than our Western counterparts. Yes, for sure.
Oh, yes.
And I see that in me too. Like, for example, I would host, like my home in Canada, I host Diwali parties, and I call everybody who's not Indian, but they like it. So it's a thing. You carry your culture with you, you modify it in a different way. But I feel the reason I would say I am successful is because I'm super connected. And when I was in India, I wasn't as connected because it was taken for granted, right? You have so many people. By the way, all your needs are met, so you don't actually have to put that effort. But when you immigrate as a single person, you know, then you suddenly realize I need to have, my network is my network, kind of a thing, right? And I think going to that, when your values, your fundamental core values are shifting, your fundamental opinions and way of connecting is shifting, then what do you think are the opportunities and challenges to deliver the vision that you mentioned?
I can't help but just respond to Diwali. Our very close friend, neighbors across our street are Indian, and they have a Diwali festival or a party. Festival, I think, lasts a number of days, but they have a party for all of their friends at our community center each year. And we have been fortunate enough to be invited. And it's been fun for us to get to know some of these people. But what is even more interesting and fun to me is to see, you know, maybe 70 or 80 people. They all know one another. They carry on conversations constantly. They're laughing, they're hugging one another. I mean, it just goes on and on and on. And I think that's just a tremendous example of how a community, for example, in the United States, that is a minority community, has found a way to connect itself together and maintain relationships that I think far exceed what many of the majority population in our country has been able to achieve.
Thank you.
So in terms of that, your question was sort of, where do we go from here? Is that the idea?
Yeah. Where do we go from here, and what are the challenges and opportunities if wherever we go? You know?
Well, I think to me, the first issue is messaging, and I think the message that needs to get out is social isolation is dangerous to your physical and mental health and well-being. In other words, I think people need to recognize that this is not just an individual thing, and we don't need to pay attention to it. I think people need to see this as a real challenge. It would be similar to, and this is one of the things we talked about a lot, though we did not try to go into it a lot in our report, because there's certainly differences. But I think when people in North America realized that smoking was dangerous for your health, at that point that it took a while, took quite a while, in fact, but it took a while, but the smoking rates began to go down, lung cancer began to decrease, and mortality rates decreased, and people lived longer. There was an example of getting the word out and then getting industries to change, et cetera. Now, it was a more focused point, et cetera. But I think if we could, but the first thing that happened was that the message got out. In other words, smoking is dangerous to your health. And that began to move individuals, and it began to move society in general to try to do something about this adverse health problem that we had in our country and in North America especially, and I think obviously European countries also. I think what we need to do first is to get the message out that loneliness and social isolation are a problem, and that we all need to, as a society, we need to be attending to ways in which we can overcome that problem. In other words, you've got, everybody's become so individualistic in the way they think about themselves and taking care of themselves. But, developing reciprocal relationships is incredibly important. I think about Robert Putnam's book, Bowling Alone, where you accumulate social capital and then you in turn, can utilize that capital when you need it. That idea that, you need to build up relationships, help people so that when you have difficulties, there's somebody there who can help you and work with you. I think that just that message is important. So the message, I believe, is the first thing. I think the second thing, and I go back to my idea, I don't think there's one intervention, but I think we need to be looking at all possible interventions. I'll give you one example of an intervention that is, it's focused, but I think it's an excellent one. Linda Freed, who is now actually the Dean of the School of Public Health at Columbia, developed a program when she was on the faculty at Johns Hopkins, where they took older individuals who potentially were lonely, but who were still quite capable of doing a number of things. And they partnered with school systems in the Baltimore area and got older persons into those schools in order to provide private tutoring for some of the students who were more at risk. Well, they did two things. First off, the older individuals were able to help these struggling students to do better. But it did another thing that may have been is equally, maybe even more important. It provided an opportunity for these older adults to get to know one another. And so those relationships continued. And so there was really a double payoff. I think the key there was that they were not just meeting to get together. They were meeting for a purpose. And if they have a purpose for which they're working, and I think about your idea of the classes that you mentioned earlier, if you're there studying something together, then that provides the opportunity to get to know one another and form the relationships. And you have something in common, just like these older adults in Baltimore had in common the goal of helping these young kids.
Mm-hmm. Mm-hmm. I think
in our model, we believe the shared purpose is very important.
Yes.
Yes. Yes. And I think just going off to what you said, I had to take notes because I would have forgotten everything I wanted to say. I think the first thing I'm going to start off with answering, you mentioned about tobacco and messaging. One of our directors, he was the person who made the ecosystem for tobacco. And we've actually got him and the company to replicate that same ecosystem for isolation.
Oh, great.
So it's excellent. I need to make him hear this episode and he'll be so happy. Anyways, I'm talking to him tomorrow. So I will tell him about this. But this is one of the things, and this is because in public health, right, you can borrow from a successful intervention and of course, tobacco cessation awareness. Mm-hmm. So I'm so glad you said it. So I'm super happy. Thank you. Good. Second is I studied at Harvard School of Public Health, and my professor, Dr. Ichiro Kawachi, who heads
the social,
yes. Mm-hmm. Yes. And he talks a lot about social capital. And of course, I learned that in, let's say 11, 12 years ago when I was doing my master's. But one of the things that I took from that class, which I applied the minute I landed in Canada as a newcomer, was most of us today make a couple of friends. And then you expect a village from a person rather than making your village. And my background previously was mother and child health. So I decided I'm going to have length and breadth of friends, because in this pandemic, the people that I used to talk to regularly, those friendships faded out because of life. of course, now we reconnected after a year or so. And, there's a lot of forgiveness, forgiving, recalibration, yes. But it's not the same again. But because I had the length and breadth of friendships, when I was in need, something was there. And it was not created out of just because I would need, like, what I'm getting at is today, people are so comfortable being friends with one or two people, but we need to have a spectrum of friendships. They could be acquaintances, yes. They could be, but we have to also give. People want to receive and not give. So that's the skills. So friendship as a skill, I guess everybody needs a copy of How to Win Friends and Influence People now.
Yes.
And then the third part, which you said about secular, so when the fundamental core of the society is shifted, because if you see nations, policies, ethics, everything comes out of that, right? Philosophical, we have a philosophical debt today. And Paul and I have spoken about how liberal arts needs to become mainstream again, because we've talked about STEM and STEM sciences. And of course, we are all a part of that, but we need the arts. Because, without arts, the humanness, you may have health, but you may not have your humanity. And that's the whole point. And I think of late, I've discovered I have a friend, he's into Stoicism. And I thought it was close to what Emerson also talked about, because the United States has built a lot on Emerson's work. And we individuals are not individuals just because it is for each other. You have to be autonomous and competent to be relatable to. So it's not just for solo existence. And Paul and I talk about that totally all the time. You can't be a useless person in the society and then be connected with everybody. You're not contributing. Yes. Right. And the last part is the pathway to success, like you said, mentor and shared purpose. This is the whole concept of ikigai, onai, and, and we're trying to translate that through our company. And of course, not be patronizing, but what is the most Western, the most liberal, democratic way to use those Eastern Japanese philosophies? Because by default, it's an individualistic society, and they're going to make only a certain level of connectedness. So what is the the win-win situation? Because if you smother people with social connectedness, then you're going to shut them off, right? Versus, let's say, an Indian, if you leave us, most of us are very connected in general, because like Paul said, it's close to the Italian culture. It's assumed, like it's by default, like you're going to call people, you're going to eat food together, you're going to do things together. So it's just not a point of contention. Here, people are lonely in a crowd, which is a different kind of a problem, versus completely being isolated and lonely. So these are my 4 points to what you said.
Okay. It's interesting. I was thinking, you mentioned about the Indian culture. Our friends across the street, we were out to dinner with them one night, and we were commenting on how quiet our neighborhood was and how nice it was that it was quiet. And the woman, Madhur, said, well, I really don't like that. Says, I really like to hear people shouting, laughing in the streets, etc. Yeah. And that just kind of totally caught my wife and I by surprise. And then then I think I understood exactly what she was talking about. I mean, she's quite happy. That's not the issue. The point is, though, is that there's something to be said for kind of being around noise and people and a crowd of some type, and not just kind of being totally isolated. So in our homes, we tend to isolate ourselves. And it would be so nice if we could kind of get over that.
Yeah. I mean, Paul knows I live in Ottawa, and sometimes it's so quiet for me because I grew up in Mumbai. And Mumbai is as loud as life can get, right? And even when I was in Boston, I used to go to New York every other weekend just to see the noise. And now I would go to Toronto, that's what I do to cope with the silence. It's, I mean, I can be quiet. I can do those practices of silent meditative stuff, but it's very challenging. And the second thing is I trained in medical as the first education, right? And it's very busy. The clinic, we used to see like 100, 200 patients in 4 hours, 3 hours, because it's a swarm. Right? It's 18 million people in the city. You gotta do what you gotta do. So for me, from that to like where I am, like even my friends ask me, how do you manage? And I'm like, I don't know. I just keep myself very busy, and I have so many projects. It's just that. It's sometimes yes. I wish I could be okay with that. They're like there's nothing moving. But especially with the Ottawa winters, it's like, I don't know. I call home more often. I mean, I anyways call home twice a day, even when I'm there. That's my normal calling home. But most of my friends, like, they call home once in 2 weeks or a month or something.
Oh, yes.
It's different. Yeah. And I call every like morning and evening. And so that's the difference you see even, I mean, and of course there's individual stuff, but this is the whole point when you're tackling social isolation. And that's why the summit that we have, we call it personalizing social connectedness. Because, if you put someone who needs a lot to talk, even to have one or two connections, that may be good, but not good enough, versus someone who's completely happy, introverted, and you put them in a crowd, they will be like, why are you doing this to me?
Yes.
I think even in Ichiro's class, he gave us an example of cardio rehab. And he said that people are like guinea pigs or like hamsters. So if a person who's had a heart attack, but he's or she is fundamentally like a guinea pig, then they would do better if you give them social interventions. But if he or she is like a hamster, their health outcomes become worse if you're giving them too much of social. And I thought that was very interesting.
Yes. Very good. Yes.
Well, Paul?
Well, what advice would you have for our company?
Well, I think you've gotten started. And so I think the first thing I'll do is commend you on what you have done so far. I think the thing that I'm really kind of caught my attention is the fact that you actually are getting people together for a purpose, learning, etc. If I had to give you any advice, I think what I would say is, I don't know how much you're collecting data to see what outcomes are, etc. But I think that, scientists like me, we depend so much on data. And outcome data for programs like what you're doing or multiple other programs related to social isolation is extremely thin. When we were working on our report, we were very frustrated when, the National Academies is very much into evidence-based outcomes and interventions. And there were multiple interventions that people had suggested, et cetera. But in terms of interventions that they could demonstrate there was a clear positive outcome, that was limited. And so I don't know how much you're doing is. I guess the advice I would give you, I'm not going to ask you how much you're doing. If you're not evaluating the outcomes in some way, that's something you should do. If you are evaluating them, then do them in a way that they really would stand the test of a significant scientific critic. In other words, you're doing it right. So those, I guess that would be, I think you're doing something that's very important. I wouldn't necessarily say add this on or take this away. I think more is evaluate, because that's what's really missing.
Thank you.
So actually, we in the end, a longitudinal study is needed.
Yeah. Oh, absolutely. Yes. And not just a longitudinal study that goes for 3 months. I'm talking about one that maybe goes up 6 months or 9 months, really trying to get baseline sense of where people are and then follow them a year later and see where they are.
That's excellent. I think Paul and I have spoken a lot about evidence-based because my background being from similar to yours in healthcare, yes. If we want to get reimbursed. So there are two things. One is, as a startup, you need to break even and at least start getting paid and getting customers on board. So we've done that bit of, what can we do, which is entertainment value and at the same time fulfilling the social impact that we want. And then the second part is this scientific aspect, the R&D budgets, getting the funding for it, having other scientists, because we don't want to be the scientists. I mean, though we both are researchers by profession, we don't want to be involved in doing this work because we may contaminate the data in some ways. So yes. I think those kind of tie-ups are very interesting for us. We also would, how do I say so? It's not just the evidence base that matters. I think what is the, at least for companies like us, we need to think in the end who will pay for the services. If it's a HMO or if it's an insurance, then what kind of evidence is enough for them to say, okay, we're going to include these programs as an outreach to people who've insured with us or who take services from us. And I think, so for us, we haven't reached that dialogue yet. We hope maybe in 6 months we get there, because, you know, you have to have some, but what you said is absolutely critical, like longitudinal study, damn sure. And we've so far, well, we've collected simple questions like, did I feel, like simple questions, right? Did I feel community? Did I not? What can we improve? And we've had some like evaluation, like a MPH program evaluation, not, we've tried to reduce the amount of clinical information that we would ask someone, because that's not the mandate of our company.
Right.
And we definitely are keen if we can find research labs or research groups who would want to work with us in this kind of work, because there has to be an appreciation on two sides, right? It has to be, okay, we can deliver this, we can get the people and this and that, and then this other side can make sure the protocol is clean. It is what it's supposed to be. So I think this is excellent advice, and it's taken to the heart very seriously. And so my last question for you, Professor, is if people want to know more about you, how can they find you?
Well, as I said, I've become emeritus, and so I'm fading into the background to some extent. But I think probably the best way would be to, if they really are interested, is they could certainly look on the web. I've got a presence there. Unfortunately, my son has the very same name I do. He's a surgical oncologist at Duke, and so if there's anything about cancer, that's him. Anything about depression and epidemiology, that would be me. But the other way would be to go on something like PubMed and just type in my name, Blazer D, and you could certainly go through and look at the publications that I have, and a lot of those now are available. And probably available in the medical libraries that people have. So those would be the two things that I could think of as kind of be a good way to get into the types of things that I've done.
Thank you. And I'll also put the link for the book that he has written, how I found it.
Yeah, that would be that book is we felt very good about that report. And so I think that would be I think it's going to be a lasting report. I mean, the field will change, but I think it will be a lasting kind of foundation for what we knew and what we continue to need to learn.
Thank you. Thank you, Professor, so much for your time.
Listen, you're welcome. This has been very enjoyable. I just wish you both the very best in this endeavor. Keep at it.
Thank you.